We can talk in one by one. We'll talk. We can use the same form.
Yeah.
Sure. तो उसको चार्जिंग में रख दो चलेगा. चलो, we'll talk together.
We are at one place. In fact, I'm in Ahmedabad. Okay. Well, I'll disconnect this.
Good evening, dear friends. Once again, we are meeting here. Now, for change, I am in Ahmedabad in Dr. Bhaskar Bhatt's house for our GH conference.
You will have to leave from your phone first.
Yeah.
Okay, done.
Meeting.
Done. Right.
Yes, this is better.
Now, this is a very important topic in any clinician's practice. You may come across this problem umpteen number of times in your clinical practice, in your life. I'm talking about acute abdomen. How often we come across, what are all the parameters which we have to take into cognizance? What are the investigations? What are the etiological factors? How do we approach in homeopathic practice? These are all very important aspects. I'll just give you one example. One of my close friends, he was my classmate, in initial days of practice, he happened to come across a patient of acute appendicitis, severe pain, and the patient happened to be his own distant relative. And he gave a medicine depending on the available totality. And according to him itself, within 1 hour, the patient felt completely relieved. The pain subsided so very much, the patient felt completely all right, complete relief of pain. So he was very happy. He was on cloud 9. In the initial days of practice, he treated severe acute appendicitis. What happened in the mid of the night? The fellow developed severe shock symptoms and he was rushed to a corporate hospital. They had to do an emergency abdominal operation and there was perforation of appendix. So these are all the intricacies. Unless we know very well what is that acute abdomen, how should we proceed further, and as a homeopath, what is our role? Now, initially, I request Dr. Vrushali. In fact, today our panelists are so great. The range you can see, the youngest of our lot, I think, but the highest follower she has, Dr. Vrushali. From there, the next best is our Ajit Kulkarni, who is an internationally famous man. Today, I don't know, he is into a very traditional attire. And the senior most person who has got the highest number of clinical practice, Dr. Bhaskar Bhai. So we have 3 great panelists today for acute abdomen to discuss all intricacies and problems, everything. So I invite Dr. Vrushali. Vrushali, please throw light on what is acute abdomen and what are the etiological factors to start with. Dr. Vrushali, please.
Thank you so much, Praveen sir. It is really a great honor that today on the 23rd Roundtable, I am becoming a panelist, wherein it's an interesting mix of people from whom I have learned. I take this honor of being a panelist with you all. Now, acute abdomen per se is a very wonderful topic for today because, as you all know, Ganeshotsav is going on currently. And people are visiting Ganesh pandals and households and consuming sweets, which is causing a lot of acute abdomen. So I'm very sure that today in our clinics, we must have at least seen one patient of acute abdomen, right? Now, going beyond, what causes acute abdomen? And it's such a broad term. I don't know whether we'll be able to cover everything of acute abdomen in this today's class. But then let's just attempt at it. So broadly, if we have to identify, we must know what are the causes of acute abdomen. Primarily, what is it that you define as acute abdomen? It is sudden, severe abdominal pain and which requires urgent medical intervention. And all parts are very, very important. It is of sudden origin. It requires immediate medical attention. So very nicely, Sir Praveen sir had mentioned about that case wherein in appendicitis, it got suppressed and it required actually surgery. So, your clinical acumen has to be very, very strong to deal with these kind of cases. So what are the common causes? It could be acute appendicitis. It could be cholecystitis. It could be bowel obstruction. It could be diverticulitis. It can be an ovarian cyst rupture or a torsion, like there is a twist in the ovarian cyst. It can be a pain because of ectopic pregnancy, the renal calculi, acute pancreatitis, gastrointestinal perforation, and very rarely, but abdominal aortic aneurysm and rupture of that. So, all these conditions, if not handled properly, can result into severe complications and at times fatality. So therefore, your physical examination has to be so sound that with just one physical examination, you should be able to arrive at a diagnosis and you have to have quick thinking. Now, physical examination, what all will you do? Primarily the physical history. So what the person has been doing just before he got that pain, that becomes very, very crucial. Detailed history of onset. So the entire LSMC, for homeopaths, it becomes easy. Location, sensation, modality, and concomitant. About how the pain has, traveled. What is the speed of the pain? Vital signs you must consider, because if it is a severe condition, in that the pulse rate would be high, or they might be losing pulse if it is diverticulitis or aneurysm. So you must examine for vital signs, general appearance of the person. It becomes characteristic even for our prescription as well as for diagnosis. If the person is bending double, then you can think about more towards renal colic. If the person is crying and yelling and rolling on the floor, it can be a renal colic or it can be a cholecystitis. But if the person is not allowing you to touch his abdomen, it could be diverticulitis. So the tenderness will tell you how much and what intensity of the pain it is there. You must palpate the abdomen and check it. So if there is appendicitis, you will have rebound tenderness. So you go on pressing the right iliac fossa, and you go on pressing it, go down, ask the person to take a deep breath and suddenly release it. If on your release, if the pain is there, and the pain, even some people have a good pain tolerance. So even if they grimace, then you know that they have rebound tenderness and you have to advise for a surgeon's opinion. Then you must put your stethoscope on the abdomen. You have to know, any person coming with abdominal pain, you have to know what are the bowel sounds. So you have to be familiar with bowel sounds. Now with YouTube, it is becoming very easy. So if new people are there, they can definitely go to YouTube and listen to bowel sounds and get themselves acquainted with it. If it is an intestinal obstruction, then you must examine all the 4 quadrants and see where the bowel sounds stop. And it is not that, you check it here, check it there, like that. No, you have to wait for 1 full minute and examine all the 4 quadrants. Then there is pelvic floor examination, a must in females. Testicular examination must in males. And if there is a hernia, then hernial examination is also a must. You ask the person to cough and you, empty the hernia first and ask the person to cough. With that, if it comes out and then the person has pain, you can think about maybe there is a torsion inside, maybe there is an intussusception. So you can then refer him for surgical opinion. So these are the things which we must, very briefly, I could sum it up, sir.
Thank you, Dr. Vrishali. In fact, when I'm listening to you, I felt as though Dr. Asrani descended into you and he is speaking through you. So very
my
good. We
God,
don't miss Asrani. You are a female Asrani. Today at least. Okay, thank you.
God,
Now,
it's a
Ajit
great
Bhai, I
listen
would
to
like
that.
to ask you, actually, you would have come across lots of cases of acute abdomen. Lots. It is not that you are known for only chronic case taking and all that. Now, when you have come across, what would be your usual approach as a senior homeopath, and how would you suggest our younger clan? How do we approach in an acute condition, acute abdomen, for example?
I think
Ajit Bhai.
when the subject was given to me, I was much relieved because I had already the PowerPoint of acute abdomen. The presentation was in many countries. So the issue is acute abdomen. First thing extremely important is the location. As per the divisions of the abdomen, right hypochondrium, left hypochondrium, and all other divisions which we have to define the pain. You will find that this particular aspect is extremely important, and you must be aware of the organs which are related to the region. For example, let us take right hypochondrium. You have small intestine, right kidney, gallbladder, and liver. Let us take left hypochondrium. You have pancreas, left kidney, colon, and spleen. This is very important because then you are with the diagnosis. This clinical diagnosis is extremely important to define homeopathic prescription. I will give more value to the location than the whole history, which we take in terms of the type of the pain, that the modalities and everything. But I have many things to offer. Let us take, for example, Praveen presented a case of feeling better with a remedy like colosynthesis, but actually the condition is septic. Now, we have to understand this colosynthesis is a neuralgic spasmodic remedy which can relieve the pain, but it cannot treat the septic process that is going on. These limitations in clinical practice must be understood. These limitations are coming from the remedial pathogenetic action. Now, this is very important. I remember a case of a appendicitis, and I was damn sure that this is a case which needs hospitalization. And meanwhile, I found a very clear indication of latrodectus mactans, that in such cases, in order that you should keep the spirit of the vitality going on, you should repeat this remedy according to the old authors, and even Dr. Tarkas wrote over it. I gave just 30 potency every 15 minutes until you go in the hospital. And as I remember, everything went so smooth. The operation was successful. So I mean to say that we must know our limitation, and in such cases, we have a very big role to play also. So the first thing as a homeopath, the anatomy, then the duration, then comes, you see, clear cut the modalities and everything, what exactly you have. And then you have to define the age of the patient also. This has been studied in clinical medicine so nicely that children, then adolescents, then adults, then below 55 age, after 55 years age, what are the percentage in the world as far as the pain in abdomen statistics is concerned. This is extremely important for a homeopath to lay hands on. It is not that you are giving Macphos and Colocynthum, Naxwamika and Asafoetida and you think that you are a good homeopath. everyone can give a good remedy, no doubt, but you have to diagnose the case and then to go ahead. Yeah.
Thank you, Ajit bhai. Thank you very much. In fact, the greatest point in Dr. Ajit Kulkarni's description, I felt, was like the diagnosis. As Hahnemann clearly put it in aphorism 3, the knowledge of disease is very vital, very important for even a homeopath to understand. As he said, like the limitation, where do we have our say? Ajit bhai, you want to add something?
Now you see, let us go beyond the concomitant symptoms. Abdominal pain with vomiting. Now, do you know this is a field where actually a lot of research has been made. Take for example, abdominal pain, vomiting is gastroenteritis, food poisoning, viral gastroenteritis, mesenteric adenitis, salpingitis, then acute gallbladder pathology, acute intestinal ischemia. Do you know a patient who has myocardial ischemia can present to you an acute intestinal ischemia because he is senile, because he had degeneration as a pathogenetic theme of the Boger's pathological journal. And a usual cause you know very well is the ectopic pregnancy with tubal rupture, where patients start vomiting incessantly. So this combination, pain with vomiting, makes a huge change in your approach. So at least you must know what are the common causes, simple causes of the pain in the abdomen. You know, in children, the big cause of pain in abdomen is hunger. Second thing common is gases. The third one is overeating. Fourth
That
one,
is for us.
travel and fatigue. Travel and fatigue can cause pain in the abdomen. Then overexertion, premature labor, and set of the labor. These are very simple causes. Then one of the causes which you cannot overlook is the use of steroids, aspirin, non-steroidal anti-inflammatory drugs, digoxin, and moreover antibiotics. These are common causes of pain in abdomen in clinical practice. And so you have to define this. You have to see how much they are implicated. And then accordingly, you have to give tutopathic drugs also. If you cannot stop these drugs abruptly. So causes is a very big consideration which involves, you see, everything. And this is something which I think in this subject fundamental. Then comes the homeopathic therapy. Yeah.
Right. Thank you, Ajit bhai. Now I would like to ask Dr. Bhaskar bhai, who has more than 43, 44 years of clinical experience, and the patients who come to him probably would never want to hear from him that they should go to a hospital. I would like to ask him the question in a different way. When did he forcibly send the patients to the hospital with acute abdomen? Dr. Bhaskar bhai.
Thanks, Dr. Praveen. Actually, this is one topic where homeopathic doctors, not only homeopathic, any doctor is testing his knowledge, his acumen, is working with the patients, because everything is important, particularly in acute problems. And acute abdomen requires many things, including pathology, the way Dr. Ajit said, the exact knowledge of the organ which is affected, and to know the anatomy, physiology, medicine, surgery, even gynec, even pediatrics. Everything is important, because every child, from child to the old age, anytime somebody can have acute abdomen. Most of the time, we all feel that painkillers will work, but it is not so. On the contrary, it may harm. Best part is to examine, to get it tested, have the blood test to know whether it is inflammatory changes or there is a infective changes like the CBCs to be done, WC increased work in UI, or you can say CRP, whether there is an inflammatory changes, or you can go for all kind of chest X-ray, or MRI, etc. At times, you require more knowledge of a general pathology to understand what is happening in the body. Many times, the pain is not so serious, particularly in the kids, and you simply give chamomile and patient is getting better, or you simply give colocin and is getting better. But if pathology is there developing, within 24 hours, you will be called again, or even within 2 hours. That depends. Now, when should we send the patient to the hospital? And that's a very vital and important question. We should know where medicine stops and surgery begins. Almost you can say 30 to 40% of the cases require surgical opinion. Homeopathy works even with the surgical cases, but you have got limitations when the things have been bad to worse. We know Amitabh Bachchan had got an injury in 83. That injury damaged the pancreas, liver, etc. And he has to be operated. He was lucky and it was in Bombay and he got all the services. It never happens with every patient. Even after 34 years or 40 years, he got a diverticulitis last year. And that too, he has to be operated. So at certain time, your medicine will work to reduce the pain, to reduce the inflammatory changes, but pathology that has developed in old age people can cause havoc if you are not taking care. So best part is to find out how much damage has gone to the organ, how much pathology has been developed, what are the reports, what are the ESR, CBC, CRP, or apart from them, kidney function test, renal function test, whatever organ is important, the function test of that organ, kidney or liver is important. Same way, X-ray, sonography, CT scan, at times they save the life. Recently, you will be surprising, we had one doctor, Dr. Sarat Thakur in Gujarat. He is a regular writer in the magazine. He's a gynecologist, but he writes article every week or stories of the patients. He wrote a story of a small village where there was a one nurse and small PSC center. And that nurse was working since 25 years, very senior. One woman got a severe pain and people say, "Kabhi, shake, warm application karo, give some medicines." She was given by somebody. And then they called, the nurse is here, doctor is not there in the PSC. She went there. She just touched the left side of the abdomen, lower part. And she said, "This is serious, ectopic pregnancy must be bursting." Immediately she was shifted to a hospital. And within 2 hours, it was operated. The life was saved. If by chance somebody trying for a medication for 2 more hours, she would have died. So we should know, or we should be aware where we should stop. We can give medicine, but ultimately, if pathology is known to us, if the seriousness we can understand, then that is the right time when we should control ourselves. Yes, I give this medicine and take her to the hospital or take patient to the hospital, go for all tests and go for the surgery, etc. All surgical cases, anyone said, are different than the acute and chronic cases. When it is pure surgical, surgeon is the only alternative. You can give medicines. But few cases, post-surgical and even pre-surgical, where you got wonderful results. I will give you an example. One gynecologist had made surgery, cesarean section, and then the woman was operated. She was normal. And after 1 month, she went back to the doctor. Doctor, I have got pain and I have got vomiting. Daily, I'm getting 8 to 10 vomiting. We went for X-ray, sonography, etc. Nothing has come. But she vomited every day, 3 to 4 times or 10 times, at times eating more. Ultimately, after 15, 20 days, that gynecologist called me, "Dr. Bhatt, something can be done for this?" I said, "Send her." I saw the patient, I talked to her, and I realized she was under stress. There is a lot of problems in the family, and she has got a lot of grief also. And after surgical intervention, she had got this vomiting. I gave her a dose of Stephaseria 30 TDS, and within 3 days, vomiting stopped totally, and she didn't get it at all for the next almost months together. She said, "Doctor साहब, ये जादू हो गया, वो थक गई थी मैं उनसे, फिर भी नहीं मिटता था. Now it is gone." So this can happen with homeopathy, that you can treat the things, but that surgery was needed at that time when it was done. So we can understand, or we should understand our limitations also, that acute abdomen at times the way Dr. Kulkarni said and Dr. Shali said, that diverticulitis, yeah, severe stone. There is another patient having a big stone of 2 centimeter and causing lot many pains. Lot of people tried, and some of the doctors said, "Use this, take this liquid, mother tincture, barbies, sulgarius, 5 drops every hourly for 3 days." You took some from somewhere, and he came to me. I said, "Your stone is stuck in the kidney. It is unable to move out of it. It is too big, and don't go for it. Go for the surgery." After surgery, he came out and said, "Now I would like to take medicine that I should not get it on and off." And constitutional medicine was given. But this is important to understand that where is your limitations. This particular part, I will deal again with a case afterward.
Thank you, Dr. Bhaskar Bhai. In fact, this is what, like, when I heard our 3 panelists, they have given the glimpses of the importance of etiology, the pathology, the diagnosis, the parameters, all these things. Glimpses why I call, because it's a big chapter and you can't cover the whole thing in just half an hour. I have given only 10 minutes to them, and I can't expect a miraculous study there. In fact, they have their own limitations. As homeopathy has limitations in acute abdomen, but also it has scope. So there is, like, now we will shift more towards homeopathic approach. I'll just give one example. One patient came to me. I was just discussing with Bhaskar Bhai earlier. Like that patient, he came with severe renal colic, and he said, "Sir, if you don't treat me in 15 minutes, I will die. I should get compulsory relief in 15 minutes. So he is giving me a time that after 15 minutes, he is going to die. So I have given aconite to this fellow because he is predicting his death. It is not correct, but yet that characteristic feature. And aconite relieved his right ureteric colic immediately. Then I followed it up with different medicines later. So the stone was passed. That is all a different issue. But what we are talking about is acute abdomen. Now I would like to ask Rushali, can you give a case in which you have taken through homeopathic perspective and some characteristic feature which has led you to prescribe a right remedy and the patient was relieved? Rushali.
Yes, sir. So, since you guys are talking about renal calculus, I remembered a very unique case wherein the symptom was very strange. So it was 18-year-old boy who had renal calculus, again right-sided, and he was in severe pain. He was just not able to pass the urine. And his mother told me that he would kneel on the floor. So he was not even going to the toilet. He was passing the urine in the bedroom itself, and he would kneel on the floor and he would bend double as if his head is touching down. And it was so strange. He would pass urine like that, and that time his pain also would reduce a little, but again his pain would come back. So this strange symptom, when I searched, and it's a very very old case, so that time I was not using so many softwares and all. So I've pulled out my boric. In boric, there is one remedy, Pereira brava, which has that exact symptom. And it was,
Exactly.
yes, and I will tell you my journey also through that. So, boric, there is a therapeutic index. If you go at the back after the remedy, therapeutic index. So, I was very young by then. So, renal calculus, I searched renal calculus, some remedies. I went to Pereira Brava. There are 3-4 remedies. I went to Pereira Brava and I saw exactly this symptom was there. So, till the time I was not reading that remedy, I did not know that this symptom is essential. I thought the mother is just, elaborately telling me. I was giving a deaf ear to her. But when I read that, it just came to me. And Pereira Brava helped to even expel that renal calculus. It was a small one, 4 mm one, but that boy was in lot of pain. So that was one case. Another case which I remember was of severe dysmenorrhea. So even after 2 days of proper discharge, the girl was in severe pain and her pain would be reduced after vomiting. So there was what I gave her was borax, and borax helped her completely relieve. So I don't know, this is again very old case. So had I defined it today, I would have known probably borax would have been her constitution, but I don't know if it was, because it completely, one episode of dysmenorrhea, I gave her borax and it just stopped. 3-4 years ka whatever dysmenorrhea that girl had. Then another case was of ulcerative colitis, a severe case of ulcerative colitis, wherein the lady was in so much pain and there was a lot of burning. Ulcerative colitis, along with cystitis, she had developed. So she had she had hematuria as well as she had bleeding in the stools. So completely, I had taken totality and I was coming to Cantharis and Merxol. So all the symptoms were covered by Cantharis, all the symptoms were covered by Merxol. I didn't know what to do. But then from my asthmatic background, what I understood was this lady was falling more into syphilitic background, and that's why I had chosen Merxol for her. And there was a complete remission of that particular episode. So ulcerative colitis case, 3 months she went without any irregular bowels and hematuria or bleeding in the stools or whatever. So these are the three cases which comes to me just like that.
Yeah. Dr. Brushali, thank you very much. This is what some characteristic feature would lead you to a right remedy selection in acute condition, because the patient is anxious, painful. So also the doctor, we will also be anxious. It's not that we have a laid down approach and we can just relax and take. So we have to take a right decision. Now I ask our Metromedica master, Dr. Ajit Kulkarni, who knows drugs in and out of them and all that. What is your experience about such rare characteristic features and rare remedies in your clinical practice about acute abdomen?
Yeah. I can cite n number of cases. The first case I will like to give you is a 30-year-old person who was operated for intestinal obstruction. But then he developed a very severe post-operative colicky pain, and he became extremely restless, discomfort. He was given some, you say, regular treatment, conventional, but he was complaining of a very severe kind of the distension of the abdomen, and the tenderness was very severe. So being my homeopathic students, you see, relative, I went in the hospital and I found that he is in extreme agonizing pain. Tongue is white coated, very anxious. And surgeon told me that this is a very typical post-operative tympanitis. So I was gathering the symptoms and I found that this is a very good case to give homeopathic treatment. As I know, post-operative tympanitis, one of the remedies opium. So I had in my mind opium, but my second brain told me that opium is mostly painless. There is insensibility. So there is a distension on the abdomen which is painless. So I wanted a painful remedy of tympanitis. So I repertorized the case and I found that Raphanus, you see, fit in very well. It has
Very good.
abdomen tender, colicky pain, breathing while aggravation, drinking while aggravation, eating amelioration, and then even, Raphanus is a hysterical remedy. So there is a very severe anxiety and hypochondriasis. So don't forget this remedy in the modern people who have dyspepsia and pain and complain psychologically of severe dyspepsia. So with Raphanus, I had only 30 potency in my clinic and I wanted to give it every 1 hour. And the fourth dose, the patient went into sleep. And when he got up, everything was normal. So this is one of the cases which I
Fantastic.
want to refer to. Borland wrote over Raffinus in his emergencies of clinical practice. And
Fantastic.
Borland, I can give you a small paragraph of Borland. I like this clinician very good.
Yeah, please
Intestinal
go ahead, Ajit bhai.
obstruction, post-operative cases. He writes over Raffinus, intestinal obstruction, post-operative cases. Always there is mild thirst, but the spasms of pain are very much aggravated by eating and drinking. In post-operative cases of this kind with patchy areas of distension, Raffinus is often much more useful than carbovage or arsenicum. In bad cases, it is certainly more useful than even lycopodium. So this is what
Fantastic.
praising to Raffinus. Now I want to report to you one more case. This is a case in the left hypogastric region since the last 2 days. 26-year-old lady. This pain goes up in the precordial area and there is a palpitation and nausea. The pain is worse by lying on the left side and by the touch. Better by warm fomentation, and she wants the windows and the door open. Better by open air. And she was diagnosed by a gynecologist that this is a kind of a inflammatory pain in the left ovary. So he diagnosed as a ovaritis. So I took the whole totality and the totality is like this. Left side of the abdomen, left hypogastric pain, worse lying on left side, worse touch, worse by anything like a stimulant. She like the coffee and whenever she will take coffee or any other stimulant, the pain will be worse. And this pain extends to the precordium. And in the study, the remedy that came out was Naja. So I repeated Naja 200 every 2 hourly water doses, and within 1 day, I think as I remember, I gave the remedy around 11:30 in the morning, and I got the report around 7:30 in the evening that she's much better. Almost more than 80 to 90% pain is better. So now Naja is a remedy with angina pectoris, with sub-pseudo angina pectoris, and with also pseudo angina pectoris. And the typical symptom, the pain extends to the cardiac region, and the pain is associated with palpitation. You know, this is a remedy which you must think of alongside lachesis, which is warm-blooded. Otherwise, Naja is a chili lachesis, which has a lot to do with inflammatory and neuralgic type of the pain. Then what could be the difference between two remedies? Lachesis is more with septic process. I have been using lachesis in appendicitis after bryonia with great success. And I have, to my credit, at least 10 cases where I have been able to avoid the surgery in acute. So this is what I think that the major difference. Then the second difference you must see is, you see in lachesis, you get a cyanotic tinge, which is early. So whenever you have something deeper, something septicemic, you must think of lachesis. I treated a case of very severe pain in abdomen in COVID-19. The patient was hospitalized already and he developed a very severe enteritis after pneumonitis. You know, this is a kind of a syndrome shifting, and the pain in one organ can extend and cause the same kind of inflammation. And what was very important was, it was very difficult for me to gather the data. But the wife told one thing, that when he passes the stool, the pain in abdomen is better. And that was, I took it as a discharge amelioration and went for Lactasis 200. And typically, not only the pain in the abdomen started getting relief, but also the pneumonitis, the cough and the septicemia and everything. And patient came out of the hospital within a span of 2 to 3 days. So these are very important cases in our clinical practice. And I remember I treated a very bad case of aneurysm of aorta. And the patient was admitted at Karad in the hospital, government hospital, Krishna Charitable, very famous hospital. And I was informed because I belong to a village and the patient was from the same village. So my uncle, my father's brother, referred this case to me that she has been with the pain and they want to operate, but her condition is very bad. And one doctor has told them that she may die out of this. So can you do something? So I took the totality. I wanted to go at Karar, but it was difficult. So I took the totality from the relatives. And you will wonder the remedy that came out was sickle car. This is called in European countries as a sickle. So I went for sickle car, again 200 potency every 1 hour. And by the way, in the evening, I gave the remedy. And in the morning, everything was very nice. After 4 days, she was sleeping very well. I was able to give a very wonderful result in a serious case with sickle car. Yeah.
Thank you, Ajit Bhai. Thank
Yes.
you very much. Actually, this is what the importance of roundtable in NJH. All great stalwarts in the panel are discussing those cases as a take-home message for the people who attend. And I really feel pity for the people who could not attend anyway, because you have missed the most beautiful description of some cases, like Brushali was telling about Parira Brava or Borax, and here Naga or these Lacases or NASA. All these things, they are all wonderful experiences of these people. Now, I'll tell you one thing, like one microbiologist was brought to the clinic with severe pain abdomen. And when I have seen everything, she was only insisting, give me IV, I will be all right. Initially, I thought she is an allopathic doctor, so she is asking for IV. For taking IV, why should she come to homeopathic doctor? She can as well go to any nursing home and they can give. Or she has a beautiful pathology setup, pathology lab setup. She can as well take there. Why all that? So I gave her Moscus. There were quite a few other things because it is not my purview to discuss about my case here, but just to give you a glimpse. So Moscus relieved her in 5 minutes. So such type of like hysterical conditions, these things do happen. It is not like, and of course, if we take these 3 panelists' description of diagnosis as an important point before we jump to the conclusion of a remedy, very important. Now, I would like to ask Bhaskar Bhai, what are all those different important characteristic features he could gather from his cases, some 2 or 3 cases where he could prescribe a remedy which probably a novice cannot think of. So, Dr. Bhaskar Bhai.
So we have got really nice cases, worth learning for everybody. I'll give a different case. Almost, I wrote that case in the NJH long back. A girl, almost 9-10 years old, came with a pain, and then when we took the history, we realized that she had been to Hyderabad, to Bombay, and she was already treated by a lot of doctors, and they have diagnosed already that she has got acute pancreatitis. She was actually operated with a stent was placed in her abdomen for these pancreatic pains if the discharge are stopped. So, but the stent was on its own came out, and she was having a terrible pain when she came to my clinic. She was almost lying down on the floor, cannot sit in the chair. I took the history from the parents, whatever she was able to tell. And at the end, I realized that she had got an injury in the abdomen when she was playing in the school, and corner of the bench struck the abdomen. And after that, she developed these pains, all these things. Diagnosis was done after 6 months, but that was the key point in my prescription. I choose the remedy Bellis perennis on the basis of soft tissue injury in the stomach abdomen. And since then, gradually her pains relieved. Now at present also she used to come at times to meet. She's now, this is a 7-8 years old case. Now she's in 10th, 11th standard. Nothing has happened in the last 5 years. They are so happy because doctor said that if pancreas is gone, nothing will happen. The injury was there nearby, and that soft tissue injury was relieved totally by Bellis perennis. There was another case. A patient came with a severe pain, and she said she has got fever, feverishness. She took medicine from the local doctor. Fever came down, but again there is a fever and pain in the abdomen. And the doctor said, go for the test, but I had come to you. I said, you should go for the test, sonography karwao. But tell me where exactly is pain. On examination, the pain came out in the right lower abdomen, particularly like the McBurney's point, the typical point where appendix is situated. The pain was only at the tip of the finger. You can say this is the part this is paining. The remedy Irish Tinex, which has got a typical pain in the right side in this way. I give Irish Tinex in water, in a cup of water, 1 teaspoonful every hourly. By evening, the pain has gone. And next day, she said, I don't go for the test now, everything is normal. No pain, no fever, no feverishness, nothing. I'm absolutely normal. This Irish Tinex has been written in Bori as a part of the Irish verse. In the actually Irish verse is the remedy, under which the remedy relationship, 2 lines are written for this. They have mentioned it's a remedy for the appendicitis. So Irish Tinex is another remedy which is very important. There was another case where actually patient came with a lot of history and doctor gone for the chest X-ray and ECG, etc. Because he had got a lot of palpitation, gastric problem, lot of irritations, uneasiness, unable to lie down, and said, I've got something, do something for me. I'm not well, and I had been to a doctor, they gave me medicines, they say admit ho jao. So I don't want to get admitted, so I came around here. They have suspected either it's a cardiac problem or some acute abdomen. I said, tell me the things, how it happened. And the wife said, yes, in last few days, they have got some problems in the business. He has a lot of tension to pay the money. He's very ambitious to earn money. He put a lot of money at some place for business and he didn't get it, the reward. So it all started since 3-4 days. And doctor said with this tension, his blood pressure is increasing, he's perspiring, and this could be a cardiac problem. So he should be admitted. But we think we should meet you. So they came down to homeopathy. I said, you are having a lot of anxiety. Calm down, sit down. Let's start with the medicine. Let us see how do you find. We started with Naxomica. It was ambition deceived, loss of business, a lot of stress, anxiety about the business. And within 12 hours, almost all pains, perspiration, all gone. He felt so comfortable within 24 hours. He said, Doctor साहब ये गलती किया सब जगह जाके खर्चा कर दिया. This is the right medicine. हमें यहीं आना था. देर हो गई. So this is what homeopathy can do. But apart from that, still I feel I had seen couple of cases where unfortunately patient has been bad to worse. And in those cases, you require sonography, you require the renal function test, liver function test to realize that how much intense the problem is and how serious it is. At times, the things can go to bad to worse. If needed, you should take opinion of the surgeon. You can go for all kind of tests and then decide whether you should continue the medication. That your medicine at a first it may work, pain may go down, but pain goes down, that doesn't mean the pathology is gone. To confirm that pathology is controlling or gradually reducing, you must confirm it. If needed, get the test done every day till you feel satisfied. Then that is important. So that is what I would like to add.
Thank you, Bhaskar Bhatt ji. Actually, that belly spur case was wonderful. In fact, if the audience would like to have more description of this injury, Dr. Dorothy Shepard's Magic of Minimum Dose is a very good book wherein she gives some experience of belly spur injury and all that. And iris tenax is also one of the best remedies for acute pancreatitis as well. So likewise, these are all the remedies, these are all the cases what we have been learning in this session of our roundtable of NJH. And these people really, our panelists, the senior panelists, they have been discussing about their experiences, selecting those cases which were a little difficult to be treated and which were off the track, like Berberis vulgaris for left renal colic. Many would have succeeded, but they are selecting such cases which are little unique, different from the track, so that you should be able to select a remedy when once the patient comes, listen to the patient or listen to the attendants, observe the patient and select a right remedy depending on the characteristic feature. Now, I think we can sum it up right now. I one case or one description as to sum up. Dr. Bhushali first.
Yes, sir. So, Ajit sir's Raffinus case reminded me of twins which I had treated when I was in college. So, it was in my family. I think I was in second or third year, and there were twins, a boy and a girl were born, and they had like whole night they used to cry, and they had not passed schools. So I had given Raffinus to both those children, and they passed such huge quantity. So they were like 3 months old, and they had passed so much quantity of stool that the whole family was amazed at how these tiny babies were holding so much of stool where. And their pain was relieved, and they were completely at rest. So these are some remedies
Fantastic.
which, unless and until you read Boric, you would not know. So I would
Fantastic.
today's
Yeah.
thing be to read Boric and to have no qualms about referring your cases to surgeon. So that
Thank
would
you.
be
Thank you, Brushali. Now I would like to ask our Ajit Bhai, Dr. Ajit Kulkarni ji, can you sum it up and tell one case or anything like that before we conclude?
Sir, you're on mute.
आप mute.
I want to introduce to you a very interesting remedy, which I think will be very useful to you, and you will get a lot of money from the patients. And the remedy is carbolicum acidum. Don't forget this remedy.
Carbolicum acid.
Acidum. Whenever you have any pathology from head to foot, where there is a septic process, there is a putrefaction, putrescence, the patient has severe colicky pain that is like belladonna. But belladonna is
Fantastic.
congestion. And
Congestion, inflammatory.
very deeper is carbolicum acidum. This is a remedy you can use more in cases of gastrointestinal tract cancer with severe pain associated with vomiting. And the vomiting is coffee ground, which you may get also in intestinal intersusception. So you can see the depth of this remedy. Moreover, what you see is a hemodynamic condition of the system very poor. So there is a hypotension, there is a coldness of the extremities, the patient is on the death brink. And you see there are few cases, no, where there is a vomiting, they have some, you see, food poisoning and this one, and they become so debilitated, like carbo-vegetabilis or with a Sorinum-like condition. They have no power. You want to give China, it doesn't work. And the patient has only one or two vomiting, not coffee ground, but they are very, very weak. And if there is a wife, husband will say that, you see, probably you need a hospitalization and IV and everything. Think of this remedy, give it a 30-200 potency every half an hour. Our vomiting will stop, pain and abdomen will stop. And Ajit, there is a invigorating effect of this wonderful remedy. the message which I want to give you is proper approach, repertorization of each case on output, belief in the clinical diagnosis, then in our location, sensation, modalities, and concomitants to make a complete symptom. And then I think you can treat acute cases, even complicated cases also. The approach must be rational and adequate. This is the need of the hour.
Fantastic, Dr. Aziz Bhai. So that is what like the experience speaks. So he made the most complicated topic of acute abdomen into a very simple one, like the follow the principles, follow the rules, follow the guidelines, that sensation, location, modality, and those associated symptoms. Don't forget it. As you have grown up, as you have become senior more, so you jump from the fundamentals, it would never happen. So don't go away from fundamentals. They would lead you to the success. Now, to wind up, I ask our senior most practitioner, Dr. Bhaskar Bhai, to tell his experience to conclude.
Thanks, Dr. Pranay. Actually, I would say something different in the medication. Acute abdomen, with the way we are learning actually in anatomy, the abdomen, they say it's a Pandora's box. Something unusual will come out before you think. What you are thinking may not be the exact pathology, may not be the exact anatomy, and there must be something different. And this has happened so many times with senior doctors even. Almost I have met surgeons who say, yeah, I was under impression that there is an inflammation only, and there come out to be a lot of pus inside. Or I was under impression there is a lot of pus, but the pus is not there, the organ is already dead. So the things that happen in the abdomen at times is very difficult to decide just by symptoms. So try to be honest to the patient, say we must need all tests to be done, blood test, x-rays, etc. We must know what exactly is going on inside. Homeopathic medicines do work according to zinc, everybody's work, provided the pathology is responsive to that remedy. At times when pathology is beyond responsive, it has gone back to worse. When the surgery is must, and even you try with the homeopathic medicines to revert back into the normal physiology, it becomes a problem. It is a caution that we should realize. On particularly young doctors, I will advise, nowadays, you are taught well in the colleges that every patient should be examined properly, every patient should be tested and diagnosed in order to have a right understanding that which medicine will work better, an acute one, a chronic one, a repetition is needed or not, what exactly we need, that is to be studied. Without knowing or without knowledge, it is difficult to take acute abdomen. It is one of the risks where you will lose your career of 10 years within just one case. That happened to a lot of people because they don't realize that pathology is really so serious. So with this caution, I will say homeopathy is such a wonderful science. We have got thousands of remedy, and our anti-inflammatory is 100 compared to modern medical science, which has got 5 or 10 remedies. Our medicines to reduce the pain, we have got thousands of, and they have got hardly 5 10 remedy which can reduce the pain. So we have got plenty of armamentarium. We have got plenty of remedies that can work, but we should be aware what we are treating and what is exactly happening in the body. So with that, I say that homeopathy definitely work wonderfully, but with caution. That is all. Thank you.
Sir, can
Thank
I
you,
share
sir. Thank you very much. Yeah. Roshali.
one quick
Roshali.
case? So I go hiking on mountains. So I was at the very close to Everest base camp, and there food doesn't get boiled. It doesn't get cooked very easily. So one of our very good trekker, he was like a star trekker, and he had severe pain in abdomen, and because the food was undigested, he had not passed stools for last 3 days, and he was having so much pain. We thought we will not be able to move forward now. We'll have to camp there itself. I had given him alumina at that point of time. After alumina, in 3 hours, he passed stools and then completely his pain got relieved. So, it acts so easily. We just have to carry a small box of our medicines along with us wherever we go. So, acute abdomens can be managed.
Thank you. Thank you. Thank you.
Finally,
Ajit bhai.
I cite my own experience as a patient. I, you see, descended from Mumbai to Istanbul. I had a seminar on the next day. I ate in the evening and I developed very severe colic pain in the abdomen. I'm a vegetarian man, non-alcoholic, 100%, but I took the vegetarian and suffered. The pain was very severe and I started tossing and became very restless, and I had a phone with my children and I became anxious. What this severe pain? And I was accompanied with a concomitant symptom which led to the remedy, frequent ineffectual urging to stool. And the pain in abdomen is worse by pressure. I just combined them, opened my medicine box and took a dose of Naxomica 1M. And you will wonder, within a span of around 10 minutes, the pain disappeared.
Fantastic.
My
Fantastic.
personal
That-
experience.
Yes, exactly. So this is what acute prescription is very important. What we have learned from our learned panel is that acute prescription is very important. Always we should remember an acute disease starts as an acute disease where there is a sudden start, there is a course which is like threatening, and it might end by itself completely with cure, or it might kill the patient. So there is every possibility of killing the patient. So we should be cautious, careful in approaching an acute case. So acute abdomen is no exception, because as Bhaskar Bhai told, it is a Pandora's box. So very difficult. We should learn all those things. And as Vrushali opened up with investigations, examination, physical examination, and Ajit Bhai was telling like the complete symptom is very vital for the prescription. So I thank all of you from NJH. So we take leave of you. It is one more roundtable conference which went well, dissipating the learning to the students, to the people, to the fraternity from NJH platform. See you once again. Thank you very much.
Thank you very much.
Thank you so much.
Yes.